communities, economies across the region, it is helpful to look at the initiatives that serve to strengthen the reliability and resilience of the healthcare sector so that it continues to defend and advance the health of the citizens. If we look at the health sector, among their crucial needs during this pandemic is energy. And as they need adequate and reliable energy for their continued operations. However, in Southeast Asia or in our region, there are communities where electricity is vastly unavailable or unreliable or are too costly. So renewable energy can provide a solution to this challenge. It can help alleviate the burden of high electricity bills and create jobs to reboot the economy. Renewable energy also reduces cleaner air, no, reduces air pollution. I mean to say, making people less vulnerable to diseases, and helps reduce greenhouse gases as well, which are the footprints of some of the sectors, including the health sector, in this climate crisis. So today we will take a look at the renewable energy initiatives of three hospitals in the region and learn their energy initiatives, how it is helping them during this pandemic, among other valuable lessons, including the challenges that they faced, and also learn how they are going to move forward with their energy initiatives. But before that, I'd like to, and this is sort of the introduction to our first speaker to give an overview. So we want to have an overview of what it's like in the region before we deep dive into the countries. So I'd like to introduce Marlon Apanada. He is recognized as he's a recognized Southeast Asia expert on clean energy, and he's a friend of Healthcare Without Harm for close to half a decade now, I believe. So Marlon is now the new Southeast Asia lead on climate and energy at the World Resources Institute, and he brings with him more than 15 years in-depth and multifaceted experience in renewable energy, green finance, biofuels, and emissions trading. He is a certified green finance specialist. He is part of the Beijing-based Green Finance Leadership Program alumni network, and he obtained a certificate on sustainable finance at the Smith School of Enterprise and the Environment at the University of Oxford. And he is now completing his MBA on renewables at the Booth University of Applied Sciences in Berlin. So, without further ado, I'd like to give you Marlon Apanada. Welcome, Marlon.
Hello, good afternoon, everyone. I can hear well, and thank you, Healthcare Harm and the Global Hospitals Initiative for inviting part of this important this afternoon. Indeed, as expressed by Sir Pez in the Our Energy 2030 Live Past on Earth Day, it is in these uncertain times that we realize the fragility of the interwoven systems we all depend on to survive. And much like the climate crisis, this COVID-19 pandemic challenges us to think about resilience, communities, and social solidarity, as these are the ingredients we need for an uncertain future. And I'm happy to have this platform to share how renewable energy can be a healthcare response and COVID-19 recovery plan as we chart our path forward. I am Marlon Apanada, Southeast Asia lead for energy and climate at the World Resources Institute. And next slide, please. I will present first a couple of context setting slides as we move forward with next slide, please. First, a affair the UN Climate Strategy, which incidentally happens to be one of the world's global COVID hotspots these days. On climate, where Southeast Asia goes, the world goes. Southeast Asia leads the world in carbon dioxide emissions growth per capita, which has seen an increase of more than 260% between 1990 and 2013, and is expected to reach the emissions level of India, largely driven by coal, with at the latest number 120 coal plants under construction. At the same time, a whopping 90% of the Southeast Asia population is forecast to suffer major damage from climate change, making it among the most vulnerable globally. And on the economic side, as a regional bloc, Southeast Asia is the sixth largest economy, with GDP growth, and these are pre-COVID levels, consistently above 5% annually. And the ASEAN's combined GDP of around 3 trillion US dollars uh, is really one of the world's largest. And most economies in the region have investment grade credit ratings that make them ripe for international investments. So, and next slide, please. But where Southeast Asia goes, the world goes indeed, because as these economies power their way towards growth and expansion, and their population continues to increase, they would need more energy. The region needs more energy. Next slide, please. Uh, right now, the power generation mix really needs massive shift. The power sector, as a whole, contributes. No, go back to the previous slide. Sorry. Uh, as the 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 region, let's go to the yeah, the power generation mix needs massive shift because as a sector, power contributes approximately 40% of global energy-related carbon emissions, and electricity consumption in Southeast Asia more than tripled between 1995 and 2016, and the region's energy demand is estimated to grow 50% over the next decade. Unfortunately, for those that are monitoring the and energy and health nexus, combustible fossil fuels accounts for 82% of more than 80% of total power generation in the region, and this just makes the low carbon energy transition imperative and urgent. If implemented, Southeast Asia's coal power fleet will be the world's largest, contributing to almost 25% of total global capacity. We have seen certain initiatives that say that energy transition is underway. We've seen that, in the Philippines, the oldest conglomerate, Ayala Corporation, has expressed their desire to be transitioning into a low carbon future and to divest into fossil fuels. And we have seen pronouncements and logistic action banning new coal. But we have to look at this as signals that need to be followed through. Next slide, please. Because in the sense of energy, the energy transition should be and could be a healthcare response. Like COVID, air pollution, and climate impacts from fossil fuels use are also a public health issue. We have seen data that shows that the social costs of energy generation from fossil fuels far outweigh their alternatives, especially right now with costs from renewables like solar and wind becoming just cheaper and more competitive than the incumbents. There's also this new study, this very interesting study released by the Asian Development Bank Institute, just published March 2020, that studied the energy pollution and health nexus and found a correlation on CO2 emissions leading to increased lung and respiratory diseases, fossil fuel consumption stimulating lung and respiratory diseases, and the results demonstrating the role of CO2 emissions and fossil fuel consumption in increasing undernourishment and death ratio. These are all groundbreaking studies that need to be verified and studied further, and but should be good inputs for us in this ecosystem of stakeholders in the healthcare community and the energy community, looking at how business as usual couldn't go ahead as we have done, especially in light of COVID. Next slide, please. And so we have seen in the past couple of months the International Energy Agency, or IEA, proposing a sustainable recovery plan for the energy sector. And this is cutting edge new study just published, if I'm not mistaken, today is still June, so this month, wherein they provided what would be measures towards sustainable recovery that creates jobs, boosts the economy, and improves energy sustainability and resilience. And we have seen that for the electricity sector, expanding and modernizing grids, promoting use of wind and solar PV, and doing more work on hydropower would really put us in this path towards sustainable recovery. And this is complemented by a couple more studies. Next slide, please. By McKinsey and Co. and the International Renewable Energy Agency, or IRENA, complementing the studies and findings of the IEA. Next slide, please. So in the McKinsey study, we have just seen that we have seen that for every there's just more bang for the buck in terms of investing in renewable energy and energy efficiency compared to fossil fuels. As you see in this chart, the difference is just staggering. You create 75 jobs in RE and 77 jobs in EE for every 27 jobs that you create for fossil fuels. So that's a May 2020 report, and then that's amid all the coronavirus recovery plans that everyone has been thinking about. There's also a June 2020 report by IRENA proposing a post-COVID recovery for resilience, development, and equality, showing that although COVID-19 will have an effect on the employment segments on the renewable energy sector, there will still be ways for the sector to respond so that it becomes a way for different stakeholders to be able to bounce back and recover. So next slide, please. And amid this, how can what are practical examples of renewable energy as a healthcare response? Next slide, please. We go back to the most basic ones, which are rooftop solar, which is an available solution for hospitals, because the most of the use of hospitals in the daytime coincides with the production of solar energy. And we've seen in this chart that the levelized cost of solar is just cheaper compared to the grid rate. Next slide, please. And we've seen this in a case study we've done with Healthcare Without Harm for one of our pilot partners in the Global Green and Healthy Hospital Network, wherein because through third-party financing, hospitals are able to implement rooftop solar solutions without having to outlay the initial capital cost. Next slide, please. And this is my final slide. This way, a third-party financier can mobilize about $300,000 of investments and allow the hospital to directly save about half a million pesos already from June to December 2019 through this innovative approaches. So renewable energy is a healthcare response because you are able to use these savings towards operations that could help you implement protocols for post-COVID recovery and response, for like PPE procurement. You're also contributing less to the to climate impacts, and you're paving the way for proof of concepts to be adopted on a wider scale because renewable energy is a healthcare response in the COVID recovery. So thank you very much.
Thank you for that, Marlon, and thank you for keeping it very brief. No, it's very concise, but it's full of information, and I think it's worth mentioning again the numbers, some of the numbers that you mentioned. Like we're sixth largest economy in the world, which means that we all have the potential resources in our region to transition if we really want to, and that if we want to feel guilty about it, 82% of our contribution to the greenhouse gases comes from coal, and yeah, I also tend to agree that COVID-19, like I mean, air pollution like COVID-19 is a health threat. So there was a study by the WHO also recently, and underscoring the fact that the vulnerabilities of population is much more complicated when you're exposed to air pollution. So you're more vulnerable to COVID-19 if you're exposed to air pollution in the first place. No, okay. So um, I also would like to ask, so hearing Marlon's presentation, I would like to interact a little bit with our participants today. So you know how to use the chat box. So you see the chat cloud, chat bubble at the bottom of your screens. Please use that. And I have a question for you. So give me one or two answers. So the question for all of you guys right now is, what do you think could be the benefits of renewable energy in your hospital or in your organizations, respective organizations? So please punch in your answers, and I'm gonna read a few of those. So we still have enough time to go back and forth. So while waiting for the answers of our participants, yeah, also like to go back to the the emphasis in Marlon's presentation that the transition to renewable energy is not only possible, especially in our region, it is also necessary as well, given how it helps improve our climate footprint as well as reduce our vulnerabilities to COVID-19 pandemic. So we have one answer here. So it helps reduce energy costs. Yep. Thank you very much for that. Any other answers? So there's another. It helps mitigate climate change, making our organizations more resilient. And another one, it serves power backup for health services in off-grid areas. Yep, yep. To operate medical equipment. Okay. Thank you very much for your answers, guys. So now we can go to the next part. Again, thank you very much, Marlon. We'll go back to you again during the discussions and Q&A as well. So I'd like to introduce our next speaker. So we deep dive now to the different hospitals in our region, as I've said earlier. So now we go to Singapore. And I would like to introduce Director Donald Y. So Director Y is the Director of the Hospital Planning and Infrastructure Department in Yishun Health National Healthcare Group. And he is also the Director of Facilities and Planning Development Office in the National Healthcare Group Polyclinics, both located in Singapore. He is the current chairperson of the Green Committee that oversees all green and energy saving initiatives in the Yishun Health Campus. He is also involved in the planning, project management of new polyclinic development and renovation of existing ones in Singapore. His formal training was in the field of mechanical engineering, and his qualifications include B engineering um, and sustainable building design, etc. So, without further ado, I'd like to introduce to every one of you again, Director Donald Dwyer. Welcome, Donald, and thank you for joining us this afternoon.
Thank you so much, Piang. I'm sorry, I'd like to apologize to everyone. There was some technical problem. I was not able to use the chat box to send the message to everyone. I could only send to Pets. And I think Pets managed to refresh the chat box. So now I'm able to send messages to everyone in this webinar. My apologies once again. So thank you so much for the introduction, Piang. So I wanted to just share a little bit about my hospital first, okay, before we go into the details. So my hospital, incidentally, is 10 years old, okay. It was opened on 28th of March 2010, and this year we have hit our 10-year milestone. And of course, briefly, I would like to let everyone know that the hospital was designed with a team of management staff, doctors and nurses to make it very green. And last year, we actually held our green conference, our GGHH conference here. And for those of you who are able to come, I think when you were walking around during the tour, you saw how green the hospital was. Because our management philosophy is to create a garden within the hospital, a hospital within a garden, so that when our patients actually come into the hospital, they don't feel that they are sick. We want to make them feel that they're in a very natural, green, and peaceful environment so that they can recover even faster. So I would like to invite everyone, if you have a chance to come to Singapore, to contact me, and I'll be happy to show you around. Okay, and hopefully the COVID pandemic will go away soon so that all of us can start travel again. So can I have the next slide? Okay, so I will now move on to the questions that I've been given. And the first question was, what about the healthy energy initiative we have implemented before COVID-19? Next slide, please. So as I mentioned earlier, the hospital was opened in 2010. It's a public hospital, and we have got 591 beds, okay? And it's an acute hospital with operating theaters, ICU, emergency department wards, and clinics to serve the northern region of Singapore. And it's actually under the National Healthcare Group, which is a cluster under the Singapore government. Next slide. Next slide, please. Next slide, please. When we first designed the hospital, one of the main focus was to be very energy efficient. I think most hospitals have been pushing for this. So it's nothing new, but it's just that my management has set some very high targets like use of passive solutions rather than engineering measures. And we were asked to work with the architects and engineers to make it 30% more energy efficient than existing public hospitals, and to design like a tropical building with good natural ventilation, use of overhangs and high ceiling so that it will facilitate airflow into the hospital, and making use of renewable energy sources like what we have in a hospital. On our rooftop, we have solar panels and solar hot water system, and we actually tried to explore using wind energy, but unfortunately, where we are not near the coastal area, so we don't get much wind, and we were not able to make use of wind energy as a possible source of renewable energy source. Next slide, please. Our hospital is designed as a V-shaped configuration of 3 blocks. So the design actually allows air to breeze, to flow in, and to skim over an existing stormwater pond. And it allows for permeability and shade, because as all of us know, Singapore lies in the equator, and when the days are hot, it is really hot, okay? So we need to provide shade for our patients and staff, but also good access to natural light and cooling breezes and views without exposure to excessive solar glare. And our subsidized ward, subsidized in the sense that our government pay for much of the hospital bill. If the patient chooses to stay in a non-air conditioned ward, is actually orientated to capture the prevailing winds that come from the north and southeastern area. So that will help to cool the non-aircon wards. Because it's a government policy that for patients to enjoy subsidy, they are not allowed to stay in the air-conditioned patient area. Next slide, please. So as I mentioned, I'm showing you the layout of the hospital. So the hospital, as mentioned earlier, consists of 3 main blocks: the private ward tower, the subsidized ward tower, and the medical center. Okay, so we designed next to a stormwater pond, and we also make use of the water in the pond, which is used for rain collection purpose to irrigate our plants. Next slide, please. And our hospital actually has aluminium fins along the building walls. So they actually channel the wind into the building by increasing the wind pressure. And our local university from National University of Singapore found that these fins would enhance airflow by 20 to 30%. We actually work with the university to do a scale model in the university's lab and did wind tunnel tests to validate this. Next slide, please. Thank you. Next slide, please. Thank you. Next slide, please. Lastly, I'd like to highlight that on our rooftop, we have got rooftop farm, and that helps to grow vegetable and fruit for our patient and to reduce the green urban island effect that will and also help to reduce heat transmission to the clinics below. Next slide, please. And of course, we did a study with the university with some researchers, and we found that visitors and staff found that the design actually helped in reducing the heat and make them feel cool, especially in the afternoon. Next slide, please. So the second question was, did this initiative help in your response to COVID-19? How? Most of our systems, as what you can see, are using architectural features, and we don't really need maintenance. And unfortunately, most of our contractors were not allowed to come into the hospital to work from April to June this year as part of our national-wide lockdown measures. And we have also been converting our non-LED lights to LED lights since a few years ago, so that there's little maintenance, and that helps to save energy and require less facility personnel or contractors to maintain them. Next slide, please. Are there valuable insights and lessons that using renewable energy emphasized during the pandemic that you can share? So, for example, we use, beside the solar panels that you see, which I have shown to you earlier, they actually could only reduce about 1% of our electricity intake from the grid, and 99% of our electricity is taken from our hospital, the grid serving the hospital, together with the town gas for cooking, and of course the potable water sources. They were transmitted or piped in with little maintenance and given by the service provider. So there was not much difference before and during the pandemic. But we have been working very closely with vendors to increase the usage and coverage of solar photovoltaic system to harness more energy from the sun. And this will help reduce the reliance of electrical intake from our electrical grid. Next slide, please. Salamat. Thank you.
Thank you for
Any,
thank you for that presentation, Donald. So yeah, I agree with Donald. If you any of you have been to Singapore and happen to pass by the Kotak Pot Hospital, you wouldn't think that you're passing by a hospital. And if you walk, through the hospital, also, the hospital doesn't give any hospital vibe. It feels like we're walking in a theme park or a park itself. It's very green, very beautiful, lots of birds, lots of small animals. So it's interacting with. It's almost like interacting with nature at the heart of the city. And also, yeah, I think it's also worth emphasizing that the hospital that Donald is working in has uh, deliberately designed the hospital to be green. So at the outset, they were they decided to make sure that the hospital that they're going to put up would be as green as it is right now, and that there are more initiatives to make it even greener. So thank you for that, Donald. Again, we'll get back to you after the presentations of everyone. And for our participants today, I know if you have questions or anything that you want to clarify, kindly hold on to those questions. We'll or you can punch those questions. I mean, at our chat box below. So again, you would see the chat cloud or the chat balloon at the bottom of your screen. So you can chat the questions, and we'll address all of them later. So thank you very much. Again, thank you very much, Donald. So we go to now from Singapore. Now we fly back to the Philippines, and we'll visit now south of the Philippines, representative from Mindanao. That's the southern part of the Philippines, Dr. Nanette Pingoy Franco. Um, so Dr. Nanette is the Chief Executive Officer and Medical Director of the Dr. Arturo Pingoy Medical Center in Mindanao. She is a Fellow of Physical Medicine and Rehabilitation of the Philippine Academy of Rehabilitation, Philippine College of Hospital Administrators, and member of the Board of Directors of the Private Hospitals Association of the Philippines. And last but not the least, Dr. Nanette is also a staunch advocate for the protection of the environment. And their hospital is a very young member of the GGHH network, but they're showing a lot of promise, which is why we want her to present today. So to showcase all the initiatives or the initiatives they're doing right now in terms of greening their hospitals, in terms of energy. So without further ado, again, I'd like to introduce Dr. Nanette Franco. Welcome, Dr. Nanette. Thank you for joining us this afternoon. You might be on mute, Dr. Nanette.
Okay, so good afternoon again. Better?
Yes, yes,
Okay,
better.
first off, I'd like to thank GGHH for this opportunity to share the story of our journey to alternative energy during this very important webinar on energy in healthcare. Next slide, please. Next slide, please. The Dr. Arturo P. Pingoy Medical Center is a 100-bed level 2 hospital located in Coronadal City in the province of South Cotabato, 600 miles down south in the island of Mindanao. It takes a 1 hour and 45-minute plane ride and another hour by land to reach us. Next slide, please. Next slide, please. Mindanao enjoys cheaper electricity rates compared to Manila. The powerful Maria Cristina Falls in the foreground is a source of hydroelectric power for most of Mindanao, but we suffer from frequent brownouts in the summer, usually more pronounced during the El Nino time. The electricity surge damages air conditioners and highly sensitive medical equipment. Next slide, please. In 2013, we crafted a 5-year strategic plan to chart the direction of the hospital, and we aim to be a green and digital hospital by 2018. Studies and experiences of other hospitals point to savings from going green, and efficiency from digital transformation also meant further savings. Practical economics played a big part in our decision. The Philippines has its share of natural and man-made disasters, and stories of hospitals struggling to operate with no power during these times struck a chord. Operating 24/7 and generating huge volumes of healthcare waste made us realize that as a hospital, we generate a lot of carbon emissions because of energy requirements and processing of our waste. We wanted to seriously put in our share of taking care of the environment. Next slide, please. Environmental activities such as planting trees, and cleaning up creeks have long played a part in our CSRs. We started to shift to LED and inverter aircon technology. And in 2015, we applied for ISO certification in environmental management systems to better carry out our environmental plan. Next slide, please. Next slide, please. In November 2017, Leandro Reviste, President and CEO of Solar Philippines, made a presentation at the annual convention of the Private Hospital Association of the Philippines. He offered an attractive package to help private hospitals in the Philippines get started on solar energy. Next slide, please. Why solar energy? Electricity expense is a big part of hospital operations and has been steadily increasing in cost. And Mindanao enjoys long hours of sunlight all year round. Since 2015, we have met with 7 solar energy providers, but back then, the cost was too prohibitive and bank financing was not easy to find. But we kept on because with solar energy, we would be saving on electricity costs for the long term, and we wanted to walk the green talk. Next slide. Our solar, next slide. Our solar rooftop design profile has 900 solar panels, generating a total capacity of 328.51 kilowatt peak, which offsets 30% of our grid electricity consumption. For us, it means that we are paying less for the 30% of our consumption. The cost will also be stable not affected by supply and demand. After a year this July, we would have reduced our carbon emissions by around 206 tons. Next slide, please. Our first solar power harvest started last July 26, 2019, and has generated 154,013 kilowatt hours for the remaining months of the year. At this time of the year, we have generated 151,984 kilowatt hours. Next slide, please. During this COVID crisis, we were confident about operations because we had a stable supply of backup electricity, and savings from electricity costs were used for COVID-19 related expenses such as engineering controls, much needed and expensive PPE, and support for operations such as transport and meals for our staff. Next slide, please. Currently, we can only generate 30% of our electricity needs. We are looking into the future when we can increase our solar generating capacity from additional rooftop installations, as well as utilize photovoltaic cells embedded in glass windows. Out of reach for now, but hey, so was the original solar project, and we did it. Next slide, please. Since 2017, there have been 8 other hospitals in Mindanao who have signed on to the alternative energy bandwagon through Solar Philippines. Next slide, please. Next slide, please. Thank you, Sister Arcelita Sarnelio, for inspiring DAPPMC to go green. Thank you, Solar Philippines, for helping us realize our solar energy project. We aim for a legacy that will allow generations to enjoy wonders of nature, such as the 7 falls in Lake Cebu, over which the highest zip line in Southeast Asia goes over. Madamo nga salamat. Good afternoon once again.
Thank you, Dr. Nanette. Thank you for sharing your story. I think it's the necessity of the frequent brownouts in the region where you are at, help drive you to be creative in solving the problem, and now you're sourcing your energy partly from solar panels, and which is a great way of addressing one problem, and now you're being able to solve other problems as well, in terms of cost, etc. So that's a great lesson, Dr. Nanette. Thank you for sharing that with us. Again, to our participants, if you have questions to our speakers, you can address them. You can punch your questions in our chat box, and we'll address them later. So now we'd like to go to another neighboring country of the Philippines. So now we go to, well, another archipelagic country. We're going to Indonesia, and here the lessons that's going to be shared by Mr. Gede Ketut Wirak Kamboja. So I hope I pronounced that correctly. So Mr. Wira, for short, is the current Director of Planning, Organization, and General Affairs of Fatmawati General Hospital, Ministry of Health, Indonesia. He took his degree in public health at the University of Indonesia, and later on finished his master's degree on professional studies in food and nutrition planning at the University of the Philippines here in Los Baños. So without further ado, I'd like to give you Mr. Wira. So welcome, Mr. Wira. Thank you for joining us this afternoon, and happy to hear your story this afternoon. I think you're on mute, sir. Wira, I think you're on mute. Can you unmute your mic? Thank you
Okay.
very much.
It's all right now?
Yes,
Okay.
we're good. Thank you.
Okay. Thank you for inviting us in this webinar. I would like to share our experience in manage the Green Hospital program in Fatmawati General Hospital. Next slide, please. Next slide. Okay, this is the profile of Fatmawati General Hospital. This is honored by Ministry of Health. Our service excellence is integrated orthopedics, integrated heart treatment, integrated cancer treatment. Our total bed is 780. Our bed occupation rate around 60 to 70. This is before COVID. Our total human resource is 2,373. Specialist doctor is 223. GP is 62. Nurse and midwife is 1,000 more, and others is 1,000 more. Next slide, please. Next slide. This is our corporate value. Next slide, please. This is how why the customer choose our hospitals. Yeah, beside our small research, because they secure that our have service excellent, competitive, good and safe, security, facility, accessibility, and our hospitals as green and clean. Next. Fatmawati Green Hospital policy. We have 4 policy. First is waste management and hazardous toxic materials. The second is environmentally friendly buildings. Next slide, please. The third is environmental conservation. Fourth is energy and water efficiency. Next slide, please. This is our program to reduce, reuse, recycle. I think this is very common. Yeah. This program also earn some cash for the hospital. Yeah. Next slide, please. This is the environmentally friendly building. Yeah, with minimal electricity. Next slide, please. This is the picture of Biopori and Hydroponic plants. Yeah, we have Biopori, we have also hydroponic plants. We harvested every 2 weeks, yeah, the plants. Okay. Next slide, please. Our hospital with a lot of open space. Yeah, we have big tree, yeah, we call bayan tree, I think, you know. Yeah, in my hospital, we have a mountain, we have a jogging track, yeah, in the hospital. Next, please. This is the Green Hospital Awards we got from the government. Yeah, 2016, we have the third award. 2017, second award, and the last 2018 is the first award we have from the government. Next, please. Now, what is the situation during pandemic? Next slide, please. During pandemic, our patient is dropped dramatically. Yes, from January to May. Yeah, our outpatients, non-executive, is down from 34,000 to 13,000. Also, the outpatient of executive also down very dramatically. The emergency also down. Yeah, the operating theater, yeah, also down. This is impact to our revenue. Next slide, please. Next slide, please. Yeah, our revenue, if we compare with the expenditure, there are gap, yeah, until May, yeah, because the patients really going down, and then the expenditure is still there, yeah, because we cannot We cannot stop the employees. We cannot stop the operational cost. Yeah, we cannot stop the PPA. So that we have to do the efficiency. Yeah, we have to do the efficiency for the hospital. Next slide, please. Next slide. What we do is we make the zoning system. Yeah, the zoning system, we conduct strictly screening between COVID-19 and non-COVID-19 patients. So this is will make secure of the non-COVID patient to come to the hospital. Yeah, around this area, the hospital area, maybe around 20% or 15% we use for zoning for the COVID area. The others, the rest, we use for non-COVID 19. Because our hospital is general hospital, we receive also the COVID-19 patient. Also, we receive the non-COVID patient. Second one is establishing the COVID-19 and non-COVID patient care zone. We put the patient with COVID in the one place. Okay, and that, in that situation, also we close some services that are not many patients. So, okay, next. We still have a big area, so okay, next slide, please. Next slide. Yeah, we use solar cell in the building that COVID patient. So we have a solar cell like this. Next. We calculate already the solar cell can be efficient about 7.45% if we use the solar cell. But this is a rough computation. We will do more detail later. Next. Okay, this is negative pressure room in our building. Next. Okay, this is another effort we use how to rewashing the PPA, the coverall. So this is also make more efficiency because in that time the PPA is very expensive, so we have to rewashing the coverall. Next. Also, we rewashing the face shield and goggles. Next. Our recommendation is during the pandemic situation, we have to clearly spreading COVID-19 and non-COVID-19 patient. So give a chance to non-COVID patient to come to the hospital. Saving operational expenditure and employee expenditure, maximizing land use and green open space, encourage the use of other energy sources like solar, biogas, wastewater, recycling. Thank you very much.
Thank you very much, Weira. So our resource persons for today are very efficient in terms of managing their presentation time. Thank you very much for that, all of you. Um, so yeah, some of the key points. I think I would be the first to say that 13.9 hectares is something is very envious. You have such a space. Not all of us have that kind of luxury in the region, no. So I'm not just speaking for the Philippines, but for the rest of the region. So and I'm thinking like if the hospital decides to put up solar in every rooftop and all of that 13 hectares worth of space, that wow, you would solve all your energy problems, enormously. But I would also like to point out that, like Singapore and the Philippines, Weira's presentation showed us that their energy initiatives go hand in hand with other green initiatives of their respective hospitals. So they're not working on just energy efficiency and energy transition towards renewables, but they're also doing other steps, no, other very important steps in greening their hospitals. And yep, and they're also enjoying, apart from the economic rewards of their efforts, we're also showed as they're being recognized by government for their effort. And I think that all of you three, all the hospitals here this afternoon that are presenting, is also some sort of a validation, a recognition as well of the green initiatives that you're taking, which is why we want to hear your story and be able to share your story across the region, and all other, wherever our participants are coming from this afternoon. And also, yep, I agree that efficiency in terms of energy efficiency at this time is very important to be coupled with using the renewable energy of your hospitals. So now we have time to go to the another the panel discussion. So before I read all the questions that are coming from our participants again, for our participants, if you have questions, please use our chat box at the bottom of your screen. Key in your questions and tell us who you want to address in your questions. But I have a few questions of my own just to kickstart our open forum this afternoon. And I have a question for Mr. Donald. Um, so, Mr. Donald, do you have other healthy energy plans or initiatives to be implemented after COVID-19 in your hospital? Or how do you think um, this clean energy initiative, your renewables, or other energy initiatives, energy efficiency, etc., can support your COVID-19 recovery? So that's for you, Mr. Donald. Thank you.
Thank you, Piang. As I mentioned earlier during my presentation, the hospital is in the process of adding more solar photovoltaic cells because, as I mentioned, in Singapore, we are located near the equator and we have a lot of sunlight. And we are trying to make use of our rooftop to put more solar panel, and underneath it, we can still grow some vegetation and fruit trees by providing shade. Aside from that, we have explored other means of renewable energy, but um, it doesn't seem that we have other choices. We have even explored trying to incinerate or burn the hospital waste by working with company, but the amount of energy that's generated is actually not much. So in the end, we felt that we will just focus on increasing the amount of solar PV cells in our rooftop.
Hmm. Yeah, thank you very much for that. Yeah, I mean, you also have enough space, and as I've said, you've apart from your energy initiative, you also have other green initiatives that runs together in parallel to your energy, renewable energy initiative in your hospital. And I think, yeah, it helps in your, uh, bringing down the costs of your operations, et cetera, et cetera. And I am glad to know that there are other plans. There is a plan to expand your photo or your solar panels in the future, which would of course increase your transition, no, to renewable energy and the savings that you're getting right now. And my next question is addressed to you, sir, Mr. Weira. Um, would you recommend to other healthcare facilities
especially the ones that are listening to us right now, the transition to renewable energy. So why or why not?
I think because, based on our experience that the using of renewable energy is very useful for us, I think we recommend even for us, yeah, even for our hospital, also still evaluate the programs, the use of renewable energy, the use of recycling. Yeah, still the evaluate, still we still evaluating. But if, of course, we recommend to others health facilities to we encourage to use this kind of energy. Thank you.
Thank you, thank you. Yeah. So I think no, yeah, especially in once you start realizing the kinds of benefits solar energy is giving your hospitals, it's kind of how do I say this? Addicting. So it ropes us in even more. No, want we want to be able to save even more, and we want to be able to use the money that we're generating out of the savings for other hospital operations in our region. So yeah, thank you for that. So my next question goes to Dr. Nanette. Um, Dr. Nanette, what would be your recommendations in order for government, so in our case in the Philippines, to speed up the development and transition of not just hospitals but our society towards renewable energy? Dr. Nanette, I think you're on mute.
I think it has to be, thank you for that question. I think it has to be a holistic approach. They need to support companies who provide solar power so that the cost will become cheaper, and they need to support also companies who plan to go into alternative energy with tax benefits or tax holidays so that people would be encouraged. And implementation of the net metering law because
Mm,
even ordinary people can sell electricity and not only provide for their own personal use consumption, but make money as well for other expenses, even just in the household. And I think hospitals have the opportunity even to go on a bigger scale. Thank
mm.
you.
Thank you for that, Dr. Net. I'm sure you have more to add. Marlon, do you want to say some more to add to what Dr. Nanette has mentioned already?
Yes, definitely. Thanks, Frank, for allowing me to chime in. Uh, the one of the key things that I've only been able to highlight is on rooftop solar, which is just for own use. But for those healthcare facilities that really want to have 100% RE, it would be great if the Green Energy Option Program, or GEOP, which is contained in the Renewable Energy Law of 2008 anyway, will be fully implemented so that small hospitals and small, even bigger hospitals that are not currently what they call contestable are able to procure 100% RE. So
Mm,
we saw from the presentation of Dr. Nanette that only up to 30% of rooftop solar based generation could be supplied to the hospital, which is just part and parcel of what the technology is until energy storage becomes mainstream, and the cost we can see really hit a critical figure. And we've seen from the case that I presented earlier that with a 200 kilowatt system, it only produces 14% of the electricity because most of the operations are in the nighttime. So with GEOP, this allows hospitals and healthcare facilities to procure 100% clean from the grid, even if they only have 100 kilowatts of use and this is already contained in the law. So that's the first one. Implementation of the Green Energy Option Program, because it has been more than 10 years that that policy hasn't been implemented, which is one of the key things in the Philippines. And I second the motion on Dr. Nanette said on net metering enhancement, not only for hospitals, but for those that have installed rooftop solar. We have seen malls that open at 10 a.m., but then couldn't operate their rooftop solar systems from 6 a.m. to 10 a.m. because there is a cap right now. So if the net metering would be enhanced and it become more flexible, so that even if you breach the 100 kilowatt cap, you're still able to peruse it because it makes sense for everyone. Especially now that we've seen the trippings in the Meralco grid because of the change in the residential and consumer profile of electricity. So we have to be more responsive. The government has to be responsive, but also the private sector, including the healthcare sector, should voice out these demands cohesively and in a more coordinated manner so that this will be acted upon. We are in a good space right now because the Energy Regulatory Commission, the National Renewable Energy Board, and the Department of Energy are all listening to consumers like us. So and I would like to have this platform to invite everyone, and then maybe the Healthcare Without Harm and WRI to work together to make it into a cohesive and coordinated ask and demand from the government to have these enhancements and implementation of existing laws be really prioritized.
Hmm. I think it's also worth mentioning that some of these laws may not be present in the other countries in the region, but the learnings that we're getting this afternoon could be a starting point for the asks of different hospitals or groups, no movements that are listening in right now. It's something that they can also look forward to, or start kickstart in their own context. So different countries can learn from, and that's actually the point of our webinar this afternoon. We want to be able to learn from all the participants this afternoon and see how we can apply what we're learning from our own perspectives. So thank you for that, Marlon. And now we can go into your questions, our participants. So there are a few questions now, and I would like to start with a question from Indonesia, from Dadang. She's asking how the present restrictions, so I'm guessing this is the COVID restrictions that we're experiencing at the moment, and that could be in Indonesia. So how are social restrictions going to affect the future influence of it affect the future influence of the global social economy transition to renewable energy? So I'm guessing how if I'm getting it right, Dadang, how is the present restrictions going to affect the entire economy that can lead towards your transition to renewable energy? Is it clear, Vera?
Sorry, I still thinking about this question. Uh, how to future influence the global socio from.
Yeah. So how the social
I can catch it.
restriction.
I cannot catch it.
Yes, so how are the restrictions right now going to affect the global economy? And if it affects the global economy, how does it affect our transition to renewable energy?
Ah, maybe you mean that the global energy in our health our facilities in Indonesia. Actually, in my place, I will answer the second one,
Mm-hmm.
the second questionnaire, the second
Sure.
question. In my hospital, we use the solar cell solar energy in one building. Yeah, in one building. That building, we use that solar only for water heating, for the water heating. Yeah, I use we use the solar cell for water heating in one building. Now, how can get 7%? Yeah, 7% of efficiency. We compare if we use the electricity compared to we use the solar cell. We got the efficiency of 7%. That's my question. My answer.
Okay. So I think also Marlon said he can add up to your answer. He can add something. Marlon, do you want to add an answer to the question?
Is like how in terms of effect of how does this uh, affect our energy transition, right? I
Yeah.
think that's how yeah. For one, the energy sector space, especially renewable energy sector space, is not isolated from everything that's been impacted.
Mm.
So all corners of the economy, society, politics are being affected by the coronavirus. Supply chains we've seen have been affected because it's all interrelated. But what we've seen so far is that it really makes sense to put ourselves in a path of sustainable recovery and a path of low carbon growth and what we call building back better because it just makes sense compared to doing it business as usual. So that's the biggest question right now. Actually, it's an ongoing debate right now. How do we make sure that we make this crisis into a real opportunity for us to put ourselves in a path towards sustainable recovery and a low carbon growth? Because if we go back to our business as usual ways, we are wasting a crisis to implement long-term solutions to social issues, health issues, and other ways of co-benefits we've seen in this webinar. We have seen that it is not only just there's an economic case for renewables, there's also a social case for renewables, and there's a health case for renewables. You just don't see this in fossil fuels. And with these new reports that we have seen, you just create more jobs with energy efficiency and renewables compared to going back to fossil fuels. You just create more co-benefits with focusing on work towards energy transition rather than going back to the old toolboxes and to the old business as usual. So how does this affect our energy transition? It will affect because in a way that if we don't act on it, we revert back to the business as usual and we waste a perfect opportunity to go set ourselves back. But it also should allow us to be more passionate and cohesive and coordinated so that we act together and implement this the way it should be done and can be done.
Yep. Thank you for that, Marlon. Does anyone want to add to the answers of Marlon and Vera? If not, we can go to the next question. It's addressed to Doc Nanette. So this was for you, Doc Nanette. Please elaborate how your solar PV helped to reduce cost except electricity cost. In your presentation, you mentioned PPEs, modification, etc., etc.
Thank you for the question. I think it is more of the savings that we got from a cheaper source of electricity because solar generated electricity is cheaper. We were able to save on that. We were able to use the savings to purchase much needed resources So it's not, am I getting across, Sir Paeng? So
Yes, ma'am.
it's more of savings from solar. We were able to spend on other necessary COVID-related expenses.
Uh-huh. Yeah.
I
So
think,
the savings that you're getting out of your solar PV system, you're able to channel towards your COVID-19 management response. So that's how that's I hope that answers your question. Uh, whoever raised that, thank you for asking that question. So now there's another question addressed to Marlon. The question is, can you elaborate further in solar financing so hospitals may know their options if they want to invest?
Yeah, I think Pats or SEAsia can help me out and show that slide, but I could already start elaborating. Uh, so one of the things that was mentioned previous slide, please. Yeah, that one. So what we have seen from Dr. Nanette's presentation is that they did the outright purchase. That's the reason why that's the upper left item. That's the reason why they had to talk to seven uh, EPCs, and then they have to provide a turnkey solution, provide a full payment. That for seeing the economics and being in this space for 15 years, that is really the most economically uh, advantageous uh, arrangement because you capture all the savings, and then after 45 years, you fully pay back the system, and then you have 20 years of free electricity. But many hospitals are basically limited in this option because there's so many other capital outlays that could use the money for, like maybe hiring more staff, hiring more equipment, expanding a floor. So a rooftop solar facility is not the priority. So that's when and then there are also hospitals that really want to just focus on operating a hospital rather than having an asset on their rooftop that they are not fully familiar with, right? So you would like to outsource the worry on someone who is more comfortable with operating a solar plant. So that's when third party financing comes in. In a way, you talk to a solar vendor so that they shoulder 100% of the capital needed, and then they arrange it in a way so that the electricity that is being generated by the system becomes the payment that you stretch over 15 to 20 years. So in this arrangement, the hospital doesn't have to cash out anything except maybe like security deposits, and then the electricity being generated by the rooftop solar plant is always cheaper than the grid. So if you are in, for example, in Mindanao, wherein you are paying 10 pesos, the solar power system should be at most 8 pesos. So you already have that 2 pesos difference. And that's what becomes your savings every month because 30% of your electricity use is no longer from your current utility, which is like Italco, Socotec, or whatever that is. And it's now 2 pesos cheaper. So you accumulate the savings. That's a win for the hospital. The solar vendor accumulates returns for its investment, which allows him to generate at least like 10% IRR, and the environment benefits because of reduced consumption from the grid. So, but this third-party financing arrangement needs to have an alignment of all the players involved: the hospital, the solar vendor, and the EPC contractor, the one who's gonna install it. No one should be too greedy or have expectations that are too much, so that this becomes a win-win for everyone. And that we have seen this in a case with facilitated by healthcare without harm, which are very, very thankful.
Thank you for that addition, Marlon. So now I have another. There's another question now addressed to Director Donald. Um, so Donald, the question is: do you have a different solar set heating setup from your solar lighting? So is there a separate setup for your heating and then lighting using solar?
In my hospital, we have a solar-related system to generate electricity to power the lights and the air conditioning equipment, and another solar system to heat up the water for the kitchen and the showers. So it's two separate independent systems.
Okay, so two separate systems for the energy and the solar heating.
Yes, correct.
Yeah. Okay. Thank you very much for that. So there's another follow-up question. Still interested on how you run your facility. How do you address the added weight from your soil on your rooftop farm? How about the water leakage? Has there been any problems regarding water leakage and I suppose watering your plants on the rooftop? And or are you using purely hydroponics technology to address the seepage?
The rooftop farm in my hospital is using normal soil, but the amount of soil that we put is very little. It's about 50 to 60 cm, and we are still able to grow quite a lot of fruits and vegetables. And to address the question about water seepage, right? When we first designed the hospital rooftop, we actually built two concrete slabs. So in between the two slabs, we have a drainage system to allow water to flow to the drain. So the water doesn't flow into the patient areas below the rooftop. And we don't use the hydroponics technology because there's nothing wrong with it. It's just that we find that using a little amount of soil, we are still able to grow quite a lot of fruits and vegetables. And we actually rotate the crops. So we change the soil quite often, and we harvest the fruits and vegetables for the patients.
Hmm. Thank you very much. Do you have a follow-up question, Dr. Nanette? So it was Dr. Nanette who asked that question. If not, we can go to the next question, Dr. Nanette.
We will visit Singapore as soon as we are allowed to
Yes,
travel.
I'm happy to show Dr. Nanette around.
We are looking forward to the visit, sir.
Yeah, sure. Thank you.
Yeah, yeah. See, we have a little bit of interaction now, and yeah, we're learning from one another. So there's another question here, addressed to, I suppose this is addressed to Marlon. So the Iloilo provincial government, so for all our participants, that's Central Philippines, is planning to put up RE in our 13 hospitals in the province. How much would be our budgetary requirements needed if we will convert it to solar PV? And I would like to add the follow-up question also, Marlon. How can we contact the financial institutions that you've previously mentioned? And I think this is for okay, just for later. The other one is for Director Donald. So just those two questions.
Yeah, yeah, that's the great thing about renewable energy because it's very responsive, right? So for the Iloilo provincial government, it would really be based on what it needs in terms of energy, how much rooftop it is, how much how even if the rooftop needs to be changed or it's a change of mindset with renewable energy. This is energy 2.0. This is not like the usual things that we get from the grid wherein it's it is so responsive and modular and designable that your cost will depend on what you really need. So if your grid is good, you could get steady supply from for example from Panelco or whoever is your electric cooperative there. You don't need energy storage anymore. So your solar PV system is just perfectly synchronized. So all of these budget items are based on what you need, but based on costs right now, we have seen the prices of solar PV systems go down from by 90% since their 2010 levels. So that's a huge. You don't get technology like that.
Yeah.
That crashes that. So right now, and then you have to look at the price of the electricity that system generates. It's always cheaper than what you get from the grid. It's producing electricity from your rooftop, which is what we call on-site renewable generation, is just the cheapest form of electricity, bar none, right now. So, talking to about how about doing solar PV, I think we could coordinate with Healthcare Without Harm in terms of reaching out to the financing institutions. I could also type down my email address because I really think that after the concept and the proof of concept that we have done with the hospitals here, this should be ready for scale up so that more hospitals and more more healthcare institutions would be able to do it at scale. We've proven it. We have the data, and over the past 2 years of hard work and the coordination with Healthcare Without Harm, we've seen how it benefits the hospitals, and we have credible data to show. And now we could really scale this up and have everyone involved. So for this, for those who are curious, we really have to tap Malaysian First Capital provider because they have number one, I think the cost of capital there is cheaper. Second, they also have the appetite to come into the Philippines and be more flexible with the needs. And third one, they also have a mandate to help hospitals that are eager and able to implement. So all of these things could be scaled up in a further platform that we could co-develop later on.
And if I may add, there's a project underway with Marlon in one of the hospitals in Iloilo City. It's just interrupted, I think, by the coronavirus.
Oh yeah.
But it should proceed, no? Once the lockdowns and everything is lifted in the province.
Yes, most definitely, and I'm really excited to do that because my roots are from Iloilo, and I really would like to help out things in Iloilo as well. So I'm happy and eager to start that project.
Yeah, yeah. Thank you for that, Marlon. So another question goes to Donald, Director Donald. So what is the mechanism of the wind fins?
The wind fins are actually aluminum panel stuck onto the wall of the hospital. So the direction of the fins, right, were designed based on our wind tunnel test, where we simulated during daytime and nighttime how the prevailing wind condition will direct the wind to flow into the patient areas. And the architect actually positioned the wind fins, which are aluminum panels, to be in the direction of the wind to channel it to go into the patient areas.
Mm. Thank you for that clarification, Donald. Another question, I think this also goes to Marlon, and the question comes from Mindanao. Do you know or suggest any third-party companies in the Philippines? I guess for Mindanao.
Yeah, the case study that I've shown was Cagayan de Oro, so that's also in Mindanao, and yeah, the capital providers are are geographically flexible, as long as everything is win-win and everyone negotiates in good faith. And this is what we are looking at as we also do COVID-19 recovery plan. Things that are sensible, logical, not too greedy, sharing revenues and sharing savings. Uh, uh, and so for Mindanao, we could definitely work with Sir Paeng's team, introduce them as well in this platform that we are gonna design, perhaps and hopefully replicate what we've done in the hospital in Cagayan de Oro to other parts of Mindanao.
Yeah. So just thinking outside the Philippines here a bit, any of our listeners right now participating in this webinar is interested in availing of that kind of financing, will it be available in different parts of the region as well, Marlon?
Yes, that's a good news today. There's a catalytic fund that is being developed to make it really a regional play with an initial focus on Vietnam, Indonesia, and the Philippines. There's a lot of everybody is taking notes now that when Southeast Asia goes, the world goes on climate. So it's not just the Philippines that there is interest. It could be and it could be and it will be out beyond the Philippines of borders. So of course there will be different on the ground realities per country. For example, in the Philippines, it just happens to be liberalized, and so we are having no subsidies in our electricity costs. That's why the grid is so high. Compared to Indonesia, for example, PLN rates are about half of our grid rates. So the arrangement might be different for each country. In Vietnam and Cambodia, it might be similar to the Philippines in terms of grid rates, so it might be faster there. But definitely all this third party financing is becoming mainstream because there's like a decade, half a decade experience already from the financial market playing on this. And it could be good if the healthcare sector jumps in because hospitals really are such an energy intensive consuming buildings. Their carbon emissions is 2.5 times more than any other building, and it just means that more opportunities could be had and more benefit could be gleaned if there's a shift to renewables.
Hmm. Okay, so there are more questions coming in, but in the interest of time, I think the bottom line here is, especially for all our panel discussants today, if you can leave your email addresses to for the participants, if they have other questions that they want to ask to you one on one, they'd be able to contact you. So please use our chat box as well. If it's okay for you guys to share your email addresses, that would be very helpful so that our participants can continue communicating with you even after our webinar. But before we proceed any further, I think I want to ask one more questions from all four of you. What would be our moving forward from here? How do we move forward from all the learnings? So considering all the learnings, challenges, etc., that all of you presented this afternoon, what would be your recommendations in terms of moving forward? So can we um, get a lady first? So Dr. Nanette. So how do we move forward from here, Dr. Nanette? What would be your recommendations for our participants? You're on mute, Dr. Nanette.
Okay. I'd like to thank the other speakers for everything that you have shared with us today. There is so much to do from everything that you've learned from them. And as we move forward, we want to be more efficient especially in energy and everything that concerns hospital operations. And for the other small hospitals like us, there is a way to alternative energy, and I think that's the way forward. And this is one of the this is one of the way we can bounce back from the COVID-19 crisis. I firmly believe that. Thank you.
Thank you for that, Dr. Danette. So we go alphabetical from here. So I'm gonna call on Director Donald. Do you have anything to add in terms of moving forward?
I just want to check in the Philippines, right? Is it still having a lockdown now?
Yes, we do. Yeah, we're still under different types of lockdowns in different areas in the Philippines. Yeah.
And how is it affecting the different hospitals' operation? And different hospitals trying to move towards renewable sources of energy to rely on maintenance workers and facility personnel from coming into the hospitals to work. Because currently in Singapore, our workers are still not allowed, a lot of them are still not allowed to come out from the dormitory or where they stay to come out to work. Because I think you all have read in the newspaper that we have many cases spreading around the workers. So we have to wait quite a while. And most of the time, when the workers cannot come into the hospital to work, our operations are affected. So I just like to hear in Philippines, do you face this problem of having hospital operations being affected by workers not being allowed to come into work?
Health workers are given priority in traveling if only they come from the same area. But if they cross from border to border, they have to undergo quarantine as well, 14-day quarantine as well as testing. That's a very timely observation. Timely, it happened to us. Our biosafety cabinet had had difficulty in operating, and we had to ask somebody to cross borders, but we had to make sure they were in complete PPE, and then we had to test them before to let them in the hospital. But other preventive and calibration activities had to be put on hold. So that's the story for now.
Thank you. Thank you.
So anything to
I
add
know,
in terms of moving forwards, Donald?
yeah, so as I mentioned, I will be looking closely with my facility team to install the solar PV because it's kind of maintenance free. There's hardly maintenance required. And so the workers don't need to come and do the maintenance. Unlike the conventional power generation plant where we still have to do the maintenance.
Mm. Yeah. Yeah, good point. Yeah, yeah. Thank you for
I
that.
don't have any more questions.
Okay. Thank you. Thank you, Donald. So, Marlon, can we hear from you?
Okay. First of all, thank you, GGHH and Healthcare Without Harm for this opportunity. I've also provided my email address here. I think going forward, it's really more about two things. One is the lessons that we have had for the past 2 years, because there's already enough information and enough community and ecosystem of stakeholders that we have been able to build. So just a matter of reaching out to everyone else about what we've learned. So related to that is the second thing, which is continued coordination and continued collaboration from different sectors. So right now we have around 50 participants in this webinar. This should be a very good core group of stakeholders as we move forward with truly acting on having renewable energy as a healthcare response at COVID-19 recovery plan. It makes sense economically, technology is there, financing is there, and case study lessons from those that have gone ahead, like Dr. Nanette, are there to share lessons. So uh, there's really no excuse we can say that, or we could. There's really a lot of help available and support available, so that hospitals and healthcare facilities around the region, not just in the Philippines, could benefit as as we've seen from others. So thank you.
Thank you, Marlon. Mr. Wira?
Thank you. Uh, COVID-19 give us very good lessons for us, very good experience for us how to manage the hospital. Since, as I mentioned before, that our patient, yeah, non-COVID patient, we have to bring them again to the hospital. No fear, the hospital is already spirited. Then the hospital also encouraged to using the energy sources like solar, biogas, yeah, waste, recycling, and everything that make efficiency in our hospital. That's all. Thank you.
Thank you, Mr. Weir. So there's one more addition in response to the question of Mr. Donald earlier, coming from also from Mindanao. The answer is that health workers are given the choice to stay at home or stay at the workplace. So that's the kind of arrangement right now for our frontline health workers. So they have that; they're given that kind of choice. Um, so if there are no other additional questions or clarifications from our participants as well as from our resource persons this afternoon, I would like to call on now the Executive Director of Healthcare Without Harm to wrap up and summarize the discussions that we've had this afternoon. So the questions that we have, the discussions that we've had this afternoon is very rich and it's very interesting. Lots of interactions as well, and I'm sure there are so many subjects that are in need of further discussions, and maybe we'll discuss those even more in our subsequent webinars. But for now, I'd like to call on the Executive Director of Healthcare Without Harm, Southeast Asia, Mr. Ramon San Pascual, to give us a summary of the rich discussion that we've had this afternoon. So on to you, Mon.
Wow. Thank you very much, Paeng, Marlon, our doctors, and colleagues from the three hospitals in Singapore, in Indonesia, and in Mindanao, in the Philippines. It was indeed a very rich discussion. From the start, we already said that this is an ongoing global green and healthy hospital set of webinars to demonstrate how hospitals are responding to the crisis of COVID-19, but even much more to build up the future. There's no way of getting back to where we came from, but rather we need to advance towards a low carbon, sustainable future that is in front of us ahead of the COVID-19, the moment we're done with this pandemic. But by the discussions that we had today, first of all, we must be able to appreciate how energy is part of the 10 set of goals of the Global Green and Healthy Hospital. All of you, from Marlon to the rest of our speakers, and I'm glad to hear again the presentation from Potikpot Hospital, the very new presentation from the Arturo Pingoy, and our very fresh, and I'm really happy to hear a hospital from Jakarta. You're based in Jakarta, right? Presenting its own case. And we are inviting you, in fact, to join us in Global Green and Healthy Hospital. But energy is part of the whole set of sustainability goals of leadership, chemicals, waste, water, transportation, food, pharmaceutical, building, and purchasing. Across that, we need the energy to run hospitals. And by today's presentation, it goes to show that we don't only aim for energy efficiency, which we also do, by the way. We did cases of audit, energy efficiency audit last year, and we will pursue this. And I'm glad to note the presence of Amang Rodriguez in this webinar. They're listening intently. I know you have your own plan of solarizing your rooftop in Amang Rodriguez. Uh, but not only renewable, but not only energy efficiency, we also need to transition quickly to clean renewable energy sources, such that we are able to contribute in minimizing the impact of climate change by reducing our greenhouse gas emission in hospitals. So as Marlon has been saying, the call is to scale up. For the past 4 years now, if we count 2016, Marlon, as when we started just discussing this and visioning what we may be able to do together. And now we have at least 3 hospitals going that have the solar panels built upon and running. And now we are also seeing other hospitals that have previous installation and harvesting. So we need to scale up. And the way to scale up, as I see it, one is to move together. And I'm glad that Marlon keeps repeating it. If any of you in the hospitals listening here have the intention or even imagining what it may look like if you put up solar energy on your roof, do approach us in Healthcare Without Harm. We will make you part of the family of green hospitals, and we will help together your whatever you got, the good intention and whatever savings you may have, the space that you have, just how it happened in the 3 hospitals under the St. Paul Hospital that are now uh, uh, benefiting, reaping the benefits of having solar panels in the roof. So that's one part there. To scale up is to move on to that journey. Now, the other question there is the financing. But as proven, there are several schemes, and one model is presented by the Arturo Pingoy Hospital. The Solar Philippines helped them out. The other is one that was shown by other hospitals, including those under the St. Paul, where in 15, 20 years, without having to cash out, they're able to install. And at the moment, they're already able to save energy, at the same time pay up the investor gradually across the years. And then these hospitals not even having to worry in terms of maintaining the solar panel because it is taken care of by the company, by the third party financing and operate and solar panel company. Now, the other part of the scaling up is to look into the actual operations. And now we are seeing various modes again. I'm happy to note, for example, what is being done in Indonesia. They're using part of it to heat up their water needs, hot water needs for the hospital. But they also set up a separate set of solar panels to use for their daily operations outside of water heating, which is one good approach there. Now, you also said that you derive 7% energy efficiency, and this is also a question whether is that the standard or can it drive up further the efficiency taken from the replacing your traditional source of energy with the solar panels. So from getting onto the journey to actually learning the experience, getting on the operational stage, and then the next part of the scaling up is to engage the program and policy makers in the government. Marlon already cited what sort of policies we have in the Philippines. I'm sure Singapore is very friendly. Indonesia's government have their own incentives, I suppose, to hospitals. Last year, we have our energy efficiency law signed by the president, including encouraging hospitals to put up their energy efficiency officers and be able to cut the cost of energy such that you are able to also cut the cost of the emission rate or the actual greenhouse gas emission in the hospital and be able to address climate change. So if we talk about, therefore, scaling up from the perspective of healthcare without harm and the green hospitals, we're talking about three things: getting more hospitals on board, refining the experience as we go through it, and as well as making sure that the policies will work in favor of more healthcare systems, finally mainstreaming renewable energy in their energy equation and lessening the dependence on what we know is climate damaging sources of energy and health damaging sources of energy. So I think what today's webinar inject a lot of energy as well in GGHH. Now we are seeing the broad spectrum of experiences. Now we are affirming that we are right in Southeast Asia, we are right in the Philippines, in Indonesia, and together with the other efforts of the GGHH, whether on waste, on energy efficiency, on procurement, on chemicals, on designing buildings, I think at the center of it is be able to achieve a more equitable sources of energy, not only coming off from the traditional, but now towards renewable. And we are here in Healthcare Without Harm to help up hospitals that are new to it, and as well as spread the lesson. So we thank all the panelists. We owe you a lot. Your experiences are vital for other hospitals. I thank my own colleagues from Healthcare Without Harm, Paeng particularly, Prisha, Paz, and the rest of our staff. We're mounting this webinar one after the other. We don't want that the COVID depression take us over, but rather we look hopeful and we act hopefully beyond COVID towards just, sustainable, and low carbon future. So thank you very much.
Thank you,
Thank you
Sir
very much.
Juan. Okay, so that was really indeed a very productive discussion, and we really need to work together to scale up this initiative. So our organization, the Healthcare Without Harm, and the Global Green and Healthy Hospitals are very willing to support you on this. So I would like to thank again our speakers, Marlon, Mr. Wira, Dr. Nanette, our moderator, Kuya Paeng, and Sir Mon, for giving your time and sharing your expertise on today's RTD. So thank you most especially to all of you who attended and are still willing to learn even during this pandemic. We hope to see you again on our next RTD to be announced soon. But please follow Healthcare Without Harm Southeast Asia on Facebook, Instagram, and Twitter for more updates. So bye for now and keep safe everyone.